5, 4, 3, 2, 1.
Hello, everybody. Good morning, good afternoon, good evening from wherever you're joining us today. Thank you so much for being here. My name is Sibulele Sibaca Nomganga, and I am saying good afternoon all the way from Johannesburg in South Africa. Today, we are talking ending the HIV epidemic. It's everyone's business. A very bold statement said by a dear friend and colleague of mine, Doreen Muracha from Kenya. It's a pity that she couldn't be here today, but I know that she's really passionate about making sure we end HIV in our lifetime. So thank you, sister, for leading us in this work that we do. Today, I am joined by esteemed colleagues and friends of mine from around the world. So I want to go ahead and ask Daniel, why is ending the HIV epidemic everyone's business?
It's not something that just affects us in the US. Everybody should be involved. I think after all these years, there should be a stronger brotherhood or sisterhood within the countries. I think we all need to reach out a little more.
I'm sure we can agree that stigma and discrimination is still a big thing. How do you think we can work around this?
I was raised Latino, Catholic, conservative. I think that social norms, religion, and culture are a big influence in how we accept information, particularly when it comes to HIV, because it's so related to sex and sexuality that sometimes it's just taboo for the conversations to even start. I think we need to go deeper in the conversations. We're having the conversations with religious leaders, with spiritual leaders, with people in the community. I think for me, what's worked is going to the spaces, not expecting the spaces to come to me.
And I just want to bring in Katarina here to talk about how we can engage more people in understanding the reality of living with HIV. I know that mental health is a huge thing, and I know that you're passionate about it, and so am I. But can you tell us a little bit more about how we can engage more people in understanding what the reality is of living with HIV?
I would have to say above all, well-being. For me, being a nurse, I have to say that we can address this with compassionate care, because this is what nurses are really amazing doing. We are talking, and Danielle was saying, we are talking about holistic care. So this is a shared responsibility throughout all healthcare units, throughout all the community parts. For me, if I can give a message to anyone, is this: be humble and be empathic all the way, whatever you are. But I have to address this topic that, like you were saying, Sibu, is regarding the culturally competent healthcare. So this is also a big barrier, because all healthcare units should be inclusive and should not have, because the stigma in healthcare settings is a reality.
I work with girls and young women, and I think a lot of our challenges as we work with them, and that's why mental health for us now has become, the next thing that we deal with on a daily basis. And so how can we best support adolescent girls and young women living with HIV who are having to deal with all of this and making sure that their mental health is not affected?
I always say that information is power. So the message of undetectable, close and transmissible is really, really important all around the communities again. So this is why HIV is the responsibility of everyone. So the information is really important. It's really powerful and empowering for young women and their families as well, and their community. I have to say hope and the power to know the choice, because the voice of the people living with HIV is really, really important.
You're basically highlighting that everyone has a responsibility and everyone has a role to play. But now I want to just have a conversation quickly now with Rebecca. We know that HIV affects people living with HIV or people who are not living with HIV. And so how can we make sure that people who aren't living with HIV are more involved in shaping the response to ending the epidemic?
Where I see the way forward in this is, which I've started doing very recently, is the rapid testing. And I'm doing that here with the trans community. And all of a sudden it becomes very clear of what this is. And you've got somebody in a room and like literally in a minute, in 60 seconds, you're going to either tell them that they have a negative or a positive. And that's where this will change. And that's why it is everybody's business. It's everybody's business to get tested. That's where the stigma lies, I feel.
We've got to start breaking down the barriers of stigma and discrimination that don't make people want to openly and willingly go test to begin with. What is the power of collaboration do you think we need that's going to improve, the awareness when it comes to, not only the knowledge around HIV, but rather maybe just let's talk about testing, that everyone gets to test. What do we need? What will collaboration do for us where that is concerned?
I just feel that when I've noticed with any of the rapid testing I've been doing recently, and it's quite a bit, that they would have had stigma around it beforehand, self-stigma and other stigma. The minute they've had a test and it comes back negative, it changes their whole dynamics around stigma. So collaboration is huge. And like if we're going to get to what everyone is talking about, that we get to 0 by 2030, we're not going to do that unless we include menopausal women and trans women.
Rebecca, you then touch on, key populations, and that's the section I want to now go into as I bring in Tang here, where we talk about the cross-sector impact and how it affects key populations, and considering the needs of key populations. And it's going to be crucial if we want to be honest and intentional about ending the epidemic in our lifetime. So tell me, Tang, why do you think it's important to have tailored programs responding to particular groups or particular key populations? And what can we learn from other programming that's already out there and who are doing well?
I think tailored program is really critical because, HIV epidemic affects different individuals with different ways. And our community also come from very different backgrounds and different contexts. One size fits all is overlooked barriers of the community. For example, like gender, sexuality, race, disabilities or socio-economic status.
I love how you speak about, and you're spot on, how you speak about one size fits all is not going to respond to the uniqueness of each of these groups. I want to bring in Randuv in here because I know you're quite passionate about community engagement. And so I really want to ask you, what do you think it will take to end HIV in perhaps under-resourced, underrepresented, and marginalized communities?
It's going to take listening, and not just listening, but responding to the specific needs of community as a result of what we have heard from our listening to the diverse needs of community, and understanding that there is no one size fits all approach, because when it comes to HIV, where you live matters. And that's something ViiV has known and has continued to learn as that truth has evolved, at least over the past 13 years or so, as we've delved specifically and deeply into communities of color in the Southern United States to understand what the epidemic looked like. And, that's part of making sure that we continue to innovate, around prevention options, to make sure that people understand what their options are and how it might fit into their lifestyles. And the more we listen, the more we understand people, the more we understand HIV and the diverse ways in which it can exist, and the diverse solutions that will carry us to the end of the epidemic.
How can advocacy groups and organizations like ViiV Healthcare work together in partnership to achieve the priorities that you just spoke about?
It's going to take all of us to end this epidemic. We can't do anything without involving everybody. And so all of us has our part to play in making HIV history. And I think about COVID, and I think about, the answers to COVID that were developed in such a short amount of time. And it was a big problem. The priority is that we synergize the best of our efforts, our thinking, our creativity and innovation, our faith, our motivation.
But while COVID was great in the sense that it showed what the global community can do to quickly, urgently, intentionally solve an issue, on the one hand, it did kind of put HIV on the back burner, and it fell off the priority list. And a lot of people now understand that, oh, the world could get together so quickly and solve an issue. Why hasn't that happened with HIV? And there are a lot of communicable diseases, many other things that we could put on the table and go, you know what? We didn't do right by a lot of the issues that many communities are dealing with on a daily basis. And I really want to bring in Daniel and Tang on this one, where I'd really like Daniel to speak about the Latin community, and for you, Tang, communities that, people who use drugs. How do we think about ending, the HIV epidemic in these particular communities? You, Daniel, first.
If COVID allowed anything, was to give us permission to reach through continents and languages and barriers. And say, we can come together. We've done it. We did it. So why is HIV such a taboo word still 40 years later that we can't do the same thing that we did with COVID? I was an addict, alcohol and drugs. I'm 17 years clean and sober now. And I will say it took me 17 years to get here. There's a very strong connection between alcohol and drug abuse and living with HIV. I've been an advocate now for almost 24 years. And I hope that some of the seeds that I planted have grown or are growing to allow the younger generations to have those conversations. I mean, in the end, that's all we can hope, is that something that I say today will inspire somebody else to say something else. And eventually those words will make their way around the world and go, wait, I said that. That was my story.
I got 20 years of sobriety. Do you know what I mean? And, for many years it haunted me because it's an honest program. And the only thing I couldn't get honest about until the last 7 years was the fact that I was living with HIV. But when you actually bring it to the surface and you share it, it just changes everything.
Thank you so much for the honesty. And, Daniel, you pointed at yourself. You looked at, the decisions and the key drivers of how you got to where you are. We've got to ask ourselves the uncomfortable questions, because once we release ourselves from those responses, we release everybody else. And this works both if you are a patient or if you're a healthcare provider. So thank you for the honesty there, Daniel, and leading us into how important it is to own our truth in this, in us wanting to end the HIV epidemic. Tang, what do you have to say about how we end the HIV epidemic in the space that you work with, especially with people who use drugs?
I mean, we need more platform and more story to be told and the voice to be heard, to make sure that we understand fully about our community, about what they are facing and what they need, and how we can design the appropriate program for them. I'm working with the TIQ community and also people who engage in campsites. We need the holistic approach in order to ending AIDS among the community. We need the community to be empowered. We need the spaces for them to speak out. We need people to listen about their voice. We need to work together. We need to collaborate. We need to stand up together to fight against AIDS and achieve the ending AIDS.
Thank you so much, Tang. Collaboration is going to be key. And now I want to head over to Katarina as we get into the last part of our conversation today. World AIDS Day on the 1st of December this year has got a huge focus on human rights and how we make sure that the efforts to end the HIV epidemic are rooted in the respect of everyone's human rights. How is that affected in the work that you do?
I have to say that focusing on eliminating stigma, ensuring equitable access to and protecting quality of care, that sometimes is really, really difficult for marginalized behaviors, whatever we are talking about, for addressing affected communities wherever we are and rendering talk about the geographic difference, and this is really important from where I live. And so the prioritize of the human dignity, I have to say should be addressed. This is really, really important because right now we are facing the first generation of people that are aging with HIV. So because we are all equal, the HIV is the same, whatever in the world is the same everywhere. So why not all people that live in the world know this, have the same information regarding HIV?
And I want to bring in Daniel now at this point. And I know that you place a lot of emphasis and importance on the U equals U messaging. How is this year's World AIDS theme around human rights? How does that blend in with, the U equals U messaging?
So for everybody, the U equals U, undetectable equals untransmittable. It opened a lot of doors for those of us who are long-term living with HIV and the possibility that we could do almost anything that anybody else can do. I would say from living a regular life, we hear stories about mothers and we hear people getting married and having children, all these wonderful things about U equals U. And when it comes to equal rights or human rights, I think it's such a beautiful gift that not everybody has understood and everybody has received. The moment, and somebody mentioned it earlier, the moment you get that diagnosis, the moment somebody says, you are now living with HIV, your life is going to change. There is something that will change mentally. There's something that changes, and there's something that would forget. You change spiritually. There's something within your spirit that will break. Can we ever fix it? No. But it's that spiritual break that sometimes causes us to fall into the stigma, the shame, the secrecy, the I'm less, but spiritual. U equals U tells me I am just as good as anybody else. And I can live a life that is fully rounded and complete. And I feel like it's more than a legal right. It's a human, it's a spiritual right. But I will circle back to the beginning of the conversation.
Sure.
There's religion, social norms, and culture. It will always block people at each level. And this is what we feel, at least me and the work that I do, is where I come in and tell folks, you can work together with your religion. You can bring in your culture and you can live with some of those social norms and still thrive living with HIV and still live in the world of U equals U. It can all coexist. It doesn't have to be enemies anymore.
I love it. I mean, and if I'm just to summarize what you just said now, for me, you've just reminded me that it is my human right, and what U equals U gives me is the right to know and believe that I'm just as good as everyone else. And I really want to chat to Randovan here about this, about irregardless of individual circumstances, everyone has the right to necessary medical care, HIV prevention, diagnosis, and treatment. I know you're big on communities. How do you feel about this where human rights is concerned?
HIV prevention, for example, is for everyone. And options for treatment needs to be a standard across the world. And I believe people need to be informed about their options so that they can make the choice that it's their life. And by working together, I think we can tackle HIV and working together to ensure that that options remain a thing. This is a human right because health and wholeness is a human right. The right to be healthy, the right to be whole, the right to be able to live your life in a way that makes you feel complete. And whether it's HIV or any other condition that makes you feel incomplete, that makes you feel less than able to live the life that you absolutely love. We all have the right to access the treatment, to access the tools, to access whatever it is that gets us to that place of wholeness.
I mean, you've just been giving me like all these massive words around health and wholeness of how do we make sure that we get ourselves to where we need to be? Tongue, around harm reduction and the next generation of advocates where basic human rights are concerned, what are your thoughts?
I think education is the key. People need to access to the education to make informed decisions, and also access to the multiple choices and options of services, what they want, whatever is fit them. We need to support the community and all key population to make sure they can live freely and they can also access to the services or whatever support that they need.
Thank you so much, everyone. And I just want to do my last rounds, in closing up this conversation around ending the HIV epidemic and how it is everyone's business. I want to start off with you, Katarina. What are your closing or parting shots where this is concerned?
We all need to work together and to involve all the community. And this is everyone's business and everyone has a responsibility to do so. I have to say that being able to co-work with everyone that is involved, it's possible to end HIV for the next 6 years. And I'm really hope from my end that I will not leave anyone behind.
Katarina, thank you for your passion and your contribution today. Tang, over to you, your closing shots.
Everyone has a role to play, right? So let's start doing something from today. Don't wait. We cannot wait to end HIV if we do nothing. Work together, and if we collaborate, I'm very sure, I'm very optimistic that we can achieve the goal and we can support the community.
Tang, thank you so much. Everyone indeed has a role to play, and may you continue to do the work you do around making sure that programming that is coming up fits the needs of all communities that we work with. Over to you, Rebecca. What are your closing shots?
It's just been wonderful listening to everybody. And I think what's really important that's not done enough is these collaborations with people from different countries with different ideas and different experiences, but they all boil down to the same thing: stigma, HIV, how to disclose, how to get tested.
Thank you so much for your contribution today, Rebecca. And now I want to hear from Daniel. What are your closing shots?
If something you heard any one of us say motivated you, pushed you, angered you, use that as the platform for the conversations you want to have in your community. We're a small fragment of the larger tapestry of HIV, and we welcome you. Whoever is watching this, listening, we welcome you to the table. Come and join us and share your ideas and let us know how we can reach your community.
Thank you so much for that, Daniel. And you're absolutely spot on. You've really just your call to action name. How do we keep this conversation going forward is going to be important. It shouldn't end here. Randovan, what would you like to leave us with this conversation today?
This conversation itself has really reiterated the power of our collective knowledge and experiences, and how far we've come. For me, is how far we can go to make HIV history. Cross connection, alignment, allyship, in awareness and empathy, and ultimately in action, as I've said, is really gonna take all of us to the end of HIV, and I believe that in my heart. I would say again that ending the epidemic is everybody's business, because health and wholeness is a human right, and I personally won't stop speaking up and won't stop trying new things until we get to the end of this epidemic.
Thank you so much for that, Randovan. And it's so heartwarming and so just encouraging to know that industry understands the challenges that various communities are dealing with on a daily basis. Thank you so much, everybody. Thank you so much for everyone who's joined us today and was a part of this conversation. We really, really appreciate your time. And to my colleagues around the world, thank you so much. You're all amazing.